I think we'll go ahead and start. So thanks everybody for coming. We really appreciate your support, and we're excited to share a lot of updates with you all. My name is Paul Riesener. I'm Communications and Operations Director at StoveTeam. First order of business is we want to take your questions. So we're going to give you a few updates. We've got all of our staff here to talk to you. But we want to take your questions at the end. So if you direct your attention on the screen up to the top right, there's a little cartoon comment. So we want to take questions via text. So if you click on that, you can type your question, do that now, do that anytime during the call, and we will answer your question at the end. If you want to include your name, that's really cool, and where you're from might be interesting too. So without further ado, I will introduce the founder of StoveTeam, Nancy Hughes.
Hi there. I know most of you. If I don't know you, I probably should know you, but thank you for coming. We are wanting to spend most of our time with Alex in the field because we think that's those stories are really fascinating. I've been hearing them almost every morning by WhatsApp, what's going on in Guatemala, where he's living, and down in the other factories. So the next person for you to meet, if you haven't met her already, is our wonderful Executive Director, Shelby.
Hi, good morning, everyone. I'm just excited to be here, and I really just want to thank all of you for your ongoing support. We're excited to share with you a little bit about what we're doing and how the COVID crisis has affected StoveTeam. I guess for all of us, this crisis has really highlighted the reason we exist. We are really working in Central America with the poorest of the poor and with women, children, and families who have already greatly diminished lung capacity in places with very weak medical systems. So I guess, with that, we're just excited to have the opportunity to share with you the work that StoveTeam continues to do. And really just thank you for your ongoing support during this crisis. We know that there's great need everywhere and all of us are affected. So I'm going to go ahead and hand it over to Mike Hatfield, our program director, and then we will hear from Alex in the field later.
All right. Good morning, everybody. Yeah, as I think you guys probably got some of our updates from Forest through communications, but as you probably know, Central America is going through a bit of a difficult time. 3/4 of our factories have been closed down as well as most of the businesses, but we just want to let you know that we're still really working hard to hit the ground running once things get going on. So we are spending this time getting our educational programming some of our flagship programming just refined and ready to go. We're still working with NGOs and municipalities, kind of getting ready for when they do open up in the coming weeks to really hit the ground running. There's still such a great need for stoves. Luckily, Nicaragua is still up and running, so we're moving some of our funds that were meant for some of our other factories to there, so we can get stoves into hands of people who need them so badly right now. So that is some good news that we're still getting stoves into people who need them into households. And then, of course, we're looking towards the future. And one of our most exciting projects that we'd love to talk about at some point is our carbon credit projects. We're working with 3 different organizations looking to move carbon credits forward. It's one of the best mechanisms we have for sustainability in our projects. It helps us validate as well as just do a really amazing impact of bringing CO2 down as well as fuel use. One of the great things that's come out of our first carbon credit projects is we've had some validation that our stoves are saving lots of CO2, lots of fuel use. So they're on a 3-year lifespan, which is probably very conservative. We're looking at 10.5 tons of CO2 savings per stove. And so now we have mechanisms for donors can offset those emissions through our website. So you should check that out if you're interested. And then a big push for us right now is just monitoring and evaluation. So part of our carbon credit projects is to look and validate that our stoves are working. So we're doing a big push on surveys right now we've got over 75,000 stoves in the field, and we're going to help with our newest person in the field. We're going to be looking into actually monitoring and evaluating those stoves that have been distributed to validate our impact. So that kind of brings me up to introducing our newest team member, who is Alex.
Hi, my name is Alex Eaton. I'm based here in Guatemala. I am in the factory right now, so if you hear background noises of banging metal, that's what it is. But yes, I'm the newest team member. I arrived here on March 1st with hopes to travel between the 4 factories, get to know the people, and try to problem solve and look at some of the issues that are going on between factories and figuring out how to solve them. I think a lot of what I've been doing for the past couple months has been adapting to change, because now that coronavirus is happening and the cases are slowly getting closer, I'm not able to travel. I'm living in a small community, but I'm coming to the factory when I can. Another part of my job is to try and help the people and help the workers of the factories that we partner with. So initially, factories were going full speed, making stoves, distributing stoves, getting stoves to people, and doing community-based outreach. But as of right now, with coronavirus, the workers are needing to eat. So if work is available, they are working to make a little bit of money to feed their families. Every day I'm in direct communication with all the other factories too. I've pretty much switched most of my work onto WhatsApp. So contacting them, communicating with them, getting to know them, and trying to solve their problems. So as we understand from StoveTeam and what I know of the field, 3 of our 4 factories are shut down. There's no orders. There's no orders means no work, which is difficult for the employees. But Nicaragua, is doing something totally different. The government is not shutting down the country. People are fearful, worried about coronavirus, and there's not a lot of help being given from the government. But the factory owner is protecting herself and her workers, but she's also still doing stove demonstrations, still making stoves, getting them to the field. But I would say here in Guatemala, El Salvador, and Honduras, the situation is pretty crippled. No public transit right now. There's people are able to go out of their houses for so many hours per day because the government is looking, at least for Guatemala, the government is looking at health as the primary focus, and trying to keep people in their houses, but that brings up a bigger situation of how do people feed themselves, and they need money to do that. So I'm happy to answer as many questions as you all have from what I've seen and give you stories from the field. But yes, this is just an introduction of me.
All right, thank you, Alex. We'd love to take some questions. It looks like as of right now, we don't have any questions yet. We want to take them via text though. So if you came in after the introduction, we'd love it if you could write your questions by using the little comment box that's up at the top right of the screen. It looks like a little cartoon, sort of like talk bubble, like you'd see above someone's head. If you click on that, you can just write a comment or a question, and we will answer it.
In the meantime, while we're waiting for a question, some questions to come, I thought I would give you an update just on, on some of the programs that are going on behind the scenes while the factories are closed down. One of them is that, as Alex mentioned, the factories are closed down, so workers cannot come in to work, and so they're having a hard time just simply buying food. So we have under our under the program of factory support, we have been working to get food baskets to workers, and that's something that is ongoing, and we would like to continue. I don't know, Alex, if you'd like to talk a little bit more about that.
Yeah, so in the community that I live in, the community that the factory is located in, there's about 1,000 people more or less. And let's say that's categorized into like 180 families. There's one NGO that does work here in the community that I got put in touch with when I first arrived. It's a group of Americans who own a religious organization that's been working in Santiago Zamora for the past 12 years. So I have done a lot of extensive research to try to figure out who's receiving food from the government, who is categorized as the poor people, and who receives more than others. And what I've been noticing is the system here is very, let's say it's debilitated. The medical system is very poor. The system of getting food to people is very good if you live close to the municipal building or you have connections. So more or less middle class people receive more food than poor people who have, no access, etc. So something I have been doing to try to help the people that I'm around is I recently purchased food bags for the 14 employees of the factory in Guatemala to get those to the people who need them most. Because right now, most people, as I've understood, are working because that's something that's passing their time, more so than I'm working to make money. Because the whole system in Guatemala, let's say, has kind of been shut down. So the wealthier people are sitting in Guatemala City and they're in their nice house with Netflix and a pool and saying, okay, we can have lockdown for the next 6 months. And usually what I'm noticing, usually the wealthier people are the ones making decisions. So then when it trickles down to little villages like I live in, people are saying day to day, how am I going to have enough money to buy the tortillas to feed my family? And then it's a cycle. It's the poor people typically don't have a voice, but they're the ones who are doing most of the work. And the wealthier people are in Guatemala City, where they have food delivery and they have grocery stores that deliver. But even in my community, as a foreigner here, there's no food delivery. I still have to walk to the store to get food, etc.
Great. Thank you, Alex. So we've gotten a bunch of questions now. Julie asked, what is the typical lifespan of a stove? Maybe Mike, do you want to tackle this one?
Bet. Sorry, I was trying to figure out how to unmute myself. My screen went wonky. Yeah, you bet. So you know what? We've been saying just for a really, really conservative 3 years, but we think it's pretty sure that it's a lot longer in the sense that, and this is what I'm alluding to with the validation is we have well over 75,000 stoves, and we certainly haven't visited majority of those. So we can't really say overall, but we've done a bunch of different surveys up to point, some of them third party. One recent one, which is exciting, that was done in Honduras and in Guatemala by a third party Microsol. After 7 years, they went and did a survey of about 1,200 stoves in each country that we were doing a carbon credit project with. And in Guatemala, it was well over 2/3 of the stoves were still in use and existence after 7 years. And in Honduras, it was a little less than 50%, which I still makes me think, obviously, if you got 50% at 7 years, you've already over averaged 3.5. So we're feeling like 3 years is a really conservative, safe number, probably much more than that.
All right. Carissa asked, would the validation project be similar to the kitchen testing we did several years ago?
Wonderful question. I can answer again. Actually, so there'll be kind of 3 stages, really. So we have this new, being Northwest beer drinkers, the stove community in the Northwest has this new statement that says your actual impact is a combination of performance and adoption, IPA. So the idea is that if a stove is not used, it doesn't matter how good it is. Even if a stove is used, if it's not good, it's not going to have the same impact. You need both impact. You need performance of a stove to be good, and you need it to be used, displacing the three-stone fire. So our survey, our methodology is going to be 3 stages. The first is a large question-based survey, which is just going to basically get at our stoves being adopted. are they displacing the three-stone fire? And that's going to be basically just being able to ask questions to find out whether people are still using the three-stone fire, trying to get an idea of how much. And then we'll move into more of an actual like KPT fuel use performance evaluation of more of a subset, a smaller group. And then the third thing that's really important is exposure to smoke. So we're also going to do a testing of actual exposure, which I've done in the past on a very small set for StoveTeam, but we'll do that in a larger set. And I'd love to talk to anybody if they're more interested in the geeky science of it all, of our M&E.
Awesome. One question that I put in, you've been talking about previously, maybe this question is probably best for Alex. Do you have any idea when Guatemala, El Salvador, and Honduras will open up?
Yeah, so I can answer that. I would say in the long term or the short term, it's very unknown. About a month ago, Guatemala had very few cases. They had about 600 cases in total in a country of about 17 million. So at that point, people were talking about, what are your summer plans? Like, where are you gonna go in June? And I remember thinking at that point, like, okay, I'm waiting for the wave to pass, and then maybe this virus will not affect Guatemala as strongly. But now at the position we're in, we have about 2,000 cases. We're up to about 150 new cases per day, and they're doing something like 1,000 COVID-19 cases per day as well. So the cases are low because the tests are low. But I would say people in the field are telling me if I'm able to go home for Christmas, that would be normal, or that would be hopeful. But before then, as we understand, the airport is closed, the borders are closed for all of the countries of Central America. Nicaragua closed their borders a bit later than Guatemala, El Salvador, and Honduras. But for the long term, it looks like the next 3 months are going to be closed as they are now. But hopefully by October, November, December, things would start to be going back to normal, or some sort of new normal.
All right, thank you. Robert asked, initially we heard COVID-19 was centered primarily in Guatemala City. Has it spread out to the outer departments? Are government reports credible?
Yeah, so I can answer that. Initially, it was in Guatemala City. That's correct, because Guatemala City has the airport. The cases came from Europe. They also came from El Salvador because flights were going, hopping to different Central American countries before they landed in Guatemala for good. Slowly, the cases have spread out. I would say it's taken about a month and a half. Initially, there were reports that there were cases about 40 minutes away from where I'm living, and people were hysteric in the beginning. But after weeks, people just kind of were like, okay, it's in that big center. It hasn't come to where we are now. But as of yesterday, the first confirmed case has arrived in San Antonio, Aguascalientes, which is the municipal center of the town that I'm living in. So it's about a 20-minute walk from my house. So now people are changing their behaviors. I would say the foreigners are social distancing, the foreigners are staying in their house. The locals are kind of nervous. It's a different sense of nervousness. It's like the cases are close, so you need to be more careful than you were yesterday. There's also a case in Ciudad Vieja, which is another, I would say, 10 minutes by car from where I live. So slowly the cases are getting closer and closer because there are people who are traveling, who are doing humanitarian work, or firefighters, or police. And the sad reality of what I'm seeing is people may be doing good, but they're also spreading the disease to the communities that are furthest away.
Thank you. Julie asked, what is life like right now for the typical Guatemalan? Obviously, this is a question for Alex, I think. But Alex,
Sure.
that story you told us recently about the factory worker that needed to go to the hospital.
Sure.
It would be great
So,
to tell that.
so in general, most Guatemalans make about $230 per month. That would be like the average laborer who's living in my town. And I would have to say that my town is probably not one of the poorest towns in Guatemala. So in effect, people that live further out may only be making $150 per month. Now, the minimum wage by law is much higher than that. It's about 320. But people in these parts typically get paid by the day or by the time or by what they're making. So the typical day for someone would be people coming to work in the factory, or people working their land if they have cows, if they have avocado trees, things like that. But now, during coronavirus, most people have been laid off. Most people rely on public transport, and most people are expecting that the buses are what's going to keep their livelihood. So now that they're shut down, more or less, as I've understood, most people are stuck at home and have no way to get to work, to buy a motorcycle, something like that. So money is very tight. So the story that I shared with StoveTeam a couple days ago, I have regularly been coming to the factory every day to talk with the workers, get to know them, try to figure out who needs help, who is in a more difficult situation than other ones. So the case came out that yesterday, one of the fathers of one of the workers had an emergency need on like Friday afternoon. And so what they did was, all the roads are closed. There are no cars in the streets, no taxis, but the firefighters have offered to become ambulance services. So if you have a great need, or you need to go to the pharmacy or go to the hospital, you can call the firefighters and they'll come and transport you to Antigua or to another place. So they rushed this man to the hospital, and what he had was a prostate problem, and he needed emergency surgery. So most Guatemalans, I would say 98% of Guatemalans, could not afford to go to a private hospital. So they go to a public hospital. There's public health care. It's not the best, but it's semi-free, or it's very low cost. So they took this man to a public hospital, and when he walked in the door, they said, "I'm so sorry, the public hospital is closed. We are focusing all of our resources for COVID-19, and we are not seeing any other types of patients." So they had to take him to a private hospital in Antigua. So on average, people make about $230 per month. The cost of this surgery that he needed costs about $1,200. So what they were telling me, no food, there's no food in the hospital, there's no medicine in the hospital. You have to buy all of these things separate. So in total, they told me they spent about $1,500, which is their family's savings for more than 20 years. So as I understood, they had to take out a loan to pay for the surgery because the public hospitals are closed.
Cool. Thank you, Alex. For people who just joined, we are taking questions right now, and we'd love to have your questions. We're doing it via text, so use the little comment box up at the top right. Looks like a little comment bubble. Feel free to write your questions in there at any point. All right, let's see here. Carissa asked, are people still able to farm?
Yes. So how I can answer this is yes, in theory, farmers are still farming. Cows need to be milked, or avocados need to be picked. people are still moving about, especially farmers. And initially, I remember in the first couple weeks when COVID was becoming a reality, I would walk around the streets and ask people, how does COVID-19 affect your life? People that were working in businesses in the city, like Guatemala City, were very affected. But people who were farmers or who are farmers would say, yeah, my life is more or less not affected. So initially, that was the case. Now that markets are closing, now that people aren't allowed to sell or transport, the problem now comes, how do you transport your avocados to a center where people are going to buy them? The other thing is we have a curfew right now that says we have to be in our house from 5 p.m. to 5 a.m. If you're caught in the streets, you get arrested, or you have to pay a fine of 7,000 quetzales, and that's about $1,000. So for most people, that's not an option. So people are staying in their house. But what it transfers to is people who are normally used to getting up really early to go work on their fields or milk their cows are not able to leave their house to go into the fields. And just what I've heard through the grapevine is usually when the curfew starts at 5 p.m., that's when policemen are running up into the fields to try to arrest the farmers who are overstaying outside past 5 p.m.
Good to know. All right, Carissa also asked, are there any educational programs for the local people about COVID-19?
Yes. So what I understand about educational programming and municipal government programming, everything has been stopped right now. The schools are closed, educational programming is closed, and more or less how I understand is the government is focusing on distributing food and dealing with the first-hand problems of COVID-19, medical and food. So initially, as I understood, there were healthcare workers from the municipality that were going door to door, asking people, educating people. But then people started protesting and saying, what is their purpose? Are they transferring the virus? Are they bringing it, germs into different people's houses? I would say in general, there's a lot of distrust to the government, to the municipal governments, because of years and years of corruption. So I would say more so the NGOs are trying to help people and give people more information. The president is speaking about every night now. He's talking about COVID-19. He's telling people what they should do. And any store you go to, you have to wash your hands with antibacterial or the Sani gel. And also it's mandatory to wear a mask.
Good to hear. All right, Julie asked, COVID is now very politicized in the US with mask battles and protests to reduce restrictions. Is there any of this in Central America?
So that's an interesting question because it's different by country. I'll give you a brief rundown. El Salvador and Honduras have been completely closed for the past month and a half. People are able to go out of their house one time per week with a specific purpose to buy food, and that's it. Guatemala has been on a curfew system that's pretty much said that people should not be going out at night to prevent people from drinking, from partying, to having fiestas, etc. So slowly, as the cases have gotten more and more and more, the restrictions have gotten stronger, meaning you should stay in your house more to prevent people from going to work, going to the farm, etc. Nicaragua has taken a totally different stance. Life is not closed. People are being suggested that they do not wear a mask. COVID is not a problem. And also people who are dying are being forced to sign a document saying they died of pneumonia that's atypical. So as I understand from my reports from Nicaragua, people are scared. The the medical system is at the verge of collapse, and people are very nervous to see what happens because the government is promoting people to go in the streets and saying, you know, why are you staying at home? Why are you wearing a mask? You're creating panic in people. Take that mask off. So some of my foreigner friends who have these cool masks that, you know, have different things on the front will tell me, I went into a grocery store, I had to use gel to wash my hands, and then a policeman came up to me and shamed me because I was wearing a mask and said, COVID is not in Nicaragua. Stop making people scared.
Thank you, Alex.
Yep.
Can you touch on the system with the white flags that you mentioned recently?
So yeah, during my time in Guatemala, while working with StoveTeam and my previous travels to Central America, typically when you're driving down the street, something you see is people will have white flags. It's just a small piece of cloth on a wooden stick, and they wave it around, and what it signifies is, I'm poor, I don't have food, please help me. And what most people give is they give a couple quetzales, maybe 10 cents, 15 cents, 20 cents, something like that. Or they just open up their window and give tortillas or some sort of food. So during the COVID crisis, people would make comments about, you know, if you're walking around the streets and you're seeing white flags, go up and help those people because they have the most need. So it's a way for people to show that they need help in a very subtle way. So when I started walking around Santiago Zamora, I would make comments to people, oh, I don't see any white flags. Why don't people have white flags here? And what I've learned through a series of service workers, mostly nurses, is that people in Santiago Zamora are too humble to put a white flag on their front door. And what I was told is that most people will starve to death in front of you before they'll ask you for food. So in giving bags of food to the workers, I have received over and over and over, thank you, Alex, thank you, Alex, thank you, Alex. I don't know how we would have survived, you know, before you came along. I'm so happy that you're giving us a voice. And I think the reality is many people in Guatemala, the poorest people, are usually taken advantage of because they don't have a strong voice. So I would say something that I'm trying to do is figure out ways to support them because in turn, they're the ones that make our stoves.
Great. Jean asked, what sanitizing products are available, if any? What about masks, and are they in use at all?
So masks are obligatory if you leave your house. This was, I would say, about a month ago. They said masks are going to become mandatory if you leave because they're something to protect yourself or to protect other people. So initially what they said is if you're sick or if you have symptoms, you should have a mask. But then the government came in and said it's illegal not to wear a mask. You'll be given a fine or put in jail. People have masks. They wear masks. People have masks for babies, masks for dogs, masks for cats. Like people are taking it very seriously to have a mask because that's what the government has said you need to have. Sanitation products have I would say when it first started, when COVID first started, it was hard to buy gel. It was hard to find masks in pharmacies. But now we've kind of gotten over a hump where everyone sells masks now and everyone's selling sanitation products. And a lot of people are buying Clorox to clean their house, to clean your shoes. When I come into the factory, they're spraying the tires of my bicycle because that was something the government came in and said is protecting you.
Great. Michael asked, what is the status of programs in Honduras?
Give Alex a little break.
Yeah.
Unless you want to keep talking, Alex. Yeah, so, so as Alex mentioned, as we mentioned, Honduras officially is closed down. But that being said, we have two really good programs going on right now, or three, I should say, in Honduras. One is an educational program with youth. One is a distribution of a large number of stoves, kind of in conjunction with that. And then we have a carbon credit project. And so in the beginning, before things shut down, we got the educational programming going with kids, and we started distributing stoves. And right now it's on pause. But like I think I mentioned, what we're doing now is just working with NGOs, the schools, municipalities, in preparation for hitting the ground running once things go. Some of those projects were meant to be 6-month projects, but we've been in communication with the funders and they understand it'll be delayed, but the plans are for them to happen, to continue and hopefully get it done by the end of the year instead of half year. That's our hopes and our plans. We have been shifting some of those stoves down to Nicaragua because of permission to make sure that there is people receiving stoves who really need them now, as Nicaragua is still up and running. But that's a little summation.
All right, thank you, Mike. Anuncia asked, do you have more military presence in the streets? Probably a question for Alex, I'm guessing.
Yeah, so what I understand is Guatemala City, Quetzaltenango, Chichicastenango, Flores, Antigua are much more controlled by government care, let's say, or the government's watchful eye than a lot of the smaller villages. So in my town, there are no police, there are no military, but I have seen the military on highways controlling who comes in, who goes out. Now, yesterday there was a story that came out that pretty much in Guatemala, small indigenous communities, including mine, are controlled by a group of elders or a group of indigenous people. So for example, the neighboring community to mine that's named as Dueñas is a mixture of mixed people that only speak Spanish, but my town speaks Quechuquel. So it's an indigenous community that is pretty much making their own rules to say, we're going to protect ourselves in this way, more so than waiting for the government or the president to say, do this. So yesterday, there was a story that came out in Solala of people getting really worried about the Pan American Highway and trucks going in and out because heavy transport has not been stopped because they're trying to avoid food shortages, gasoline shortages, etc. So what they were doing in Solala is burning tires on the highway and saying, if the government's not going to give us money for food, we're going to stop all transport. So now people are starting to protest more and say, we're dying, we're starving, we need food, we need money. How are we supposed to live? While Guatemala City people are just like, okay, we'll stay in our house and get the grocery store to deliver some food to us.
Good to know. All right, so I know you already talked about Nicaragua, Alex, but John asked if you could talk a bit about the situation in Nicaragua, and I wonder if you have anything else to say about it.
Yeah, so I can give some more tidbits about Nicaragua. Nicaragua, I would say, in Central America is like the outlier. People are worried. They're worried about the future. They're not sure about the future. And the person that I talk to most from Nicaragua is Alita, who is our factory owner. And Alita has asked me questions like, I don't know if it's safe to go out into the street, but the government is pushing us to go out. They're organizing fiestas. They're organizing carne asados, which are like barbecues. So they're trying to pull people out of their house to bring them into the streets to have a big party. So a couple of weeks ago, I followed some people on Facebook who live in Nicaragua on the Atlantic side, and they were like, we're having street parties and fiestas, and it's a great time, and no one's worried about coronavirus. Like, it's an American thing. And I think a lot of what Nicaragua is receiving is a lot of propaganda from the government, just keeping them in a sense of, we don't know what's happening. We don't know how many cases. We don't know if tests are available. We don't know about the medical system. So I would say the smartest people are protecting themselves, but the majority of people are following the advice of the government, which probably will have long-term effects in the end.
Sure.
And then I'll add, just, I don't know if that's what Dave was getting at, just people, I think we said it, but our factory is still up and running. So Alita is still producing stoves, and we're trying to get them out there. So just want to say a little bit of as much as Nicaragua has some clouds on the horizon, that's a silver lining for us that we still have stoves getting produced and placed.
Alex, can you also mention about the burials at night in Nicaragua?
Yeah, so there are two things that I've learned in the past couple of days about Nicaragua. One is that anybody who's dying of what they consider atypical pneumonia or COVID is being buried at night by people in hazmat suits. And if loved ones or relatives come up and get too close, the paramilitary is coming and pointing guns at people and making them scared and saying, go back to your house. This is not happening. You should not know about this. This is confidential, top secret information. So people are worried because they don't know what's actually happening in the country. On paper, they say that 25 people have COVID-19 in Nicaragua. Guatemala has about 2,000. So in reality, people think it's more like 5,000 to 10,000 people have COVID-19 in Nicaragua, but there's no true statistics from the government. The other thing is Nicaraguans here in Guatemala, there's a field worker who I live near that I'm constantly in contact with, who's saying, like, I don't know if I can get home. I don't know if I will ever be able to leave. The other thing that she was telling me is that the European Union is considering putting an international quarantine on Nicaragua, meaning anyone who's coming out of Nicaragua or going into Nicaragua would not be able to pass through the European Union. So it's creating problems for people, let's say in Guatemala, who are saying, I'm Nicaraguan, I'm trying to go home. Is it safe for me to go home? Should I go home or should I stay?
Okay. Our last question for now, Captain Mike asked, are you hearing or seeing starvation? Where is it the worst?
Hearing starvation, yes. Seeing starvation is a bit harder. Last week, I was doing I was doing a survey of people and their use of stoves, what they do, just asking certain questions about the stoves they use, how many people eat in them or eat in their kitchen per day. When I was doing that survey, I could see poverty, let's say, greatly in front of my eyes. Now, something I would tell you about starvation, if I don't see people starving like we see pictures from Africa. It's interesting here, which I'm constantly telling StoveTeam, is people might have no money, they have no prospects for the future, but they will still buy Coca-Cola and Doritos chips. So when I see the little kids running out of a store with a 2-liter of Coca-Cola, the way my mind works, it says, maybe they're not starving because they have enough money to buy this Coca-Cola. But in reality, what I'm noticing and what I've asked people about, I say, why do you buy Coca-Cola? And a lady told me yesterday, she said, we don't have we don't have money to pay for tortillas, which is kind of the basis of life here. They're very cheap. And she said, Coca-Cola helps my kids pass the night because they're hungry. And I explained, I said, Coca-Cola has sugar. They get a sugar high and then they fall asleep. And she said, it's cheaper to buy Coca-Cola than it is to just buy, other food products. In theory, what I've told people is rice and beans and tortillas are cheaper than buying Coca-Cola, but it's kind of a national crisis, I would say, of everyone's hooked on Coca-Cola.
That's tough. Captain Mike asked another question. My understanding is the US government has shut down aid. Is this true? Impact or reaction?
I don't know all the specifics of the US government and what is coming in and what is not coming in. I would say a lot of what I've heard about aid coming in, there's a lot of corruption involved, meaning the food comes to the port receives the food, the customs agent says, oh, this is a humanitarian shipment. I'm looking for a $20,000 bribe in my back pocket before this food is going to move. So in the area that I live, I've connected with about 5 NGOs who are buying food from people and getting food at a good price. But as I understand, it's not World Health Organization, it's not World Food Program, or it's not these major other NGOs that we expect just to do food projects. Whatever's coming here, I would say whatever I have seen from the US came before the crisis and is being distributed versus a container truck coming and just giving free food out to the people who need it. The other thing I can tell you about the way that I've understood food being given to people, you might have a very poor person in a community that really needs food, but because they did not vote for the mayor or because they don't have connections to the mayor, their house almost gets checked off the list and said, nope, they don't need food. So some of the middle class people who I've come across or connected with who say, yes, I voted for the mayor and I receive food shipments every week. So it's kind of a corrupted, broken system of who gets food and why they get it.
All right, thank you. Maybe this question is for Shelby. We'll see who wants to answer this one. This is from Julie. Are there plans for STI, StoveTeam, to continue funding or find funding to help feed factory workers and their families during this time?
Yeah. Yes. So I guess I would say, we are all about stoves for sure, but during this time we have had to remain flexible and like we said, the 3 of our 4 factories are closed down, and so we are working to be flexible to help our workers receive food during this time. We view it as support of our factories, and we need the factories to be sustainable and to be ready to be up and running once this COVID crisis is over. So we're just responding to the crisis as it comes along, and we think that providing food for our workers is part of this. We were lucky to have a large order of stoves that we were able to shift to Nicaragua, and so we are. One of the reasons we're doing this call with you all is that we just want you all to know that we are still here. We're behind the scenes. We are working to make sure that on many different levels, StoveTeam is remaining strong and viable, and that includes our factories. So responding to immediate need, where we are accepting donations that we can direct either to food for our workers, to stoves, which we will be delivered. We can send them to Nicaragua, or we can keep orders with our factories as they get back up and running. It helps them to know that there are orders that will be coming for stoves. And then, like Mike mentioned, we're still working behind the scenes on the carbon credit programs, which provide, it's more of a long-term approach, but provides sustainability for our factories. So yes, to answer your question, yes, absolutely.
Yeah, and I'll add a little bit, like, so programmatically, we have funding for stoves, and we are approaching the funders and asking the question, do you mind if, as needed, we can shift a little bit of the funding for stoves to meet the immediate food needs of our workers who produce the stoves? And so we're expecting that they'll be flexible, and maybe within reason, we'll be able to move a little bit of funds for food.
All right, thank you. Susie says that she missed the beginning. She'd like Alex to describe the community he's living in.
Yeah, Susie. So I live in a community called Santiago Zamora that backs up to Acatenango volcano. So Acatenango is a dormant volcano. I am safe. There's no eruption going to affect my life. But the next volcano over is Fuego, which is active. So at night, we can see smoke and lava coming out of the top. There are about 180 families in my community, and the range of who lives there goes from semi-wealthy to very poor. A lot of people in my community receive remesas or remissions from the United States, so people working and sending money home. There's about 1,000 people. The factory is about 5 minutes walk away from my house. So it's got a cute little center with a church and a park. And I would say people are going about their daily lives as best as they can, and trying to make ends meet.
I don't think people know that you live within walking distance of the factory.
Oh yeah, so I live within walking distance of the factory. I chose not to live in Antigua because I wanted to perfect my Spanish and get to know the people that I'm working around. So out of the 14 employees of the factory, 3 of them live in Santiago Zamora, and about 8 of them live in San Antonio, Aguascalientes, and the rest of them live somewhere in between or further outside of the territory. So I would say, interestingly, most of the people of Santiago Zamora have knowledge of the factory but have never gone. So one of the things I'm trying to do is set up tours for people to come to the factory and see what's going on, see what's being sold, so that it kind of connects a community to what we do.
All right, thank you. So I want to take a second. That's all the questions that people have written. If you have a question, please write it right now. Otherwise, we'll close the meeting soon. But I want to make sure that everyone can ask a question if they have it. And in case some people can't do it through the comment system, let's see how this goes. Feel free to unmute yourself and ask a question if you want. All right, well.
I will share one thing that I think gives a good picture of what's going on here. I myself, I'm from North Carolina, and I communicate with my parents very regularly. And I think something I'm realizing about America versus Guatemala or Honduras, El Salvador, Nicaragua. In America, we base our lives on a long-term future and saving for the future, making sure that we have money for retirement, etc. I would say Guatemala and Central America is very day by day. People make money, they have money, they buy their food for that day, and that's it. They're used to buying tortillas 3 times a day, 2 times a day, because they want it fresh, and most people don't have a refrigerator. Why? Because a refrigerator uses up electricity at all hours of the day. So the idea is just very short term. So a crisis like this puts a lot of people on the edge of their reality. And what I mean by that is we Americans typically say, oh, I probably would not like to spend my savings, but I guess I'm going to have to do that. And then we move forward with life. But most Guatemalans say, my kids are going to starve. And initially, when I first came, I would say, we need to teach people how to have a long-term, trajectory of their life. Like, we need to teach them those skills. But then I started to realize that's not about the culture. The culture is not long-term. So I think any donations that we get, we will channel them down to Central America. The reason being because people need it most and they don't have that buffer zone or savings for a rainy day that's going to help them over the next 6 months. They're literally coming to me and saying, how am I going to pay for tortillas tomorrow? And I say, well, hopefully you will have a job tomorrow.
Thank you, Alex. We got a couple more questions. Hinkle asked, can you leverage carbon credits to get food or assistance funding during coronavirus, meaning the sale proceeds of credits can go straight to aid? Maybe Mike can tackle this one.
Yeah, I mean, kind of answer is no, in the sense that mainly because of, we have two mechanisms right now to get funds through carbon credit. One is an active carbon credit program that has already generated credits. And when those sales happen, then there's funding that comes to do a few different things. And yes, if we were to have another sale from that, then yes, those funds could be used for that. But those sales happen sporadically, and there won't be one probably in the next few months per se. If there is, then that's one thing. The other is that StoveTeam is kind of doing its own internal offsetting to allow people to do that. But the general idea of that is it's going to translate into a stove in the field. So we could definitely, if somebody was to offset their carbon, we could maybe have a discussion with that person of like, well, would you like your aid to go to food? But directly speaking, if we're going to offset someone's carbon, we need to get a stove in the field.
All right, thank you. Julie said, we would like to donate $100 today to go towards food support and wonder if anyone else here would like to join us. Well, thank you, Julie. I want to say one thing about that, and that is that everyone is more than welcome to donate directly to food aid through the website. There's when you make a donation through the website, there is a little spot where you can write a note along with your donation. So if you specify this is for food aid for the factories, feel free to write whatever you want. We'll get in touch with you to confirm.
The other thing I'll say about food aid is I have a partnership with this NGO that made the food bags for me that I delivered yesterday. And I said to them, would you be willing to make more food bags for me? And they said yes. In El Salvador, Honduras, and Nicaragua, we have the en route to be able to get food bags to those people as well. I think if money comes in for that purpose, we definitely will get it to the workers that need it.
Great. Thanks, Alex. All right, we'll take a second. If there are any last questions, that is all the questions.
I just would like to make a comment about the carbon, because I've been working with an organization based in London, actually, about future carbon credits. If we can get stoves out, there's a huge demand for carbon credits now. So there are a lot of people wanting to buy carbon offsets once we get the stoves out. So it's important to do that, but that won't come for probably 6 months to a year.
Right.
Yeah. And I just want to say, I'll just jump in here. I really just want to say thank you for joining us here. Whether you have volunteered with us in the past to build these factories 11 years ago, or have participated on trips to build stoves, if you are a board member, if you are, far afield in Canada or in Kentucky, I'm pleasantly surprised how many of you joined us this morning. And I just want to say thank you. You all are the reason that we exist and the reason we continue to exist. And we just really appreciate your ongoing support and your interest. So, you know, we will get through this crisis. We'll get back to work. And I just ask you to stay with us, read our emails, let us know. Forrest does a fantastic job of communicating the stories that Alex is sending from the field. So we just want to say thank you for being with us, and we appreciate your support.
All right, thanks everybody for coming. That's it. We're gonna shut the meeting down now, and we'll be posting this on our YouTube soon. Thanks very much.
Bye.
Thanks,
Bye.
everybody.
Bye. Thank you.